Welcome to Breath and Pain Experience. My name is Dr. Justin Ternes. I'm a physical therapist, breathwork specialist. I enjoy studying, learning, thinking about pain and how pain influences people's lives, often in not the best way. Often pain isn't a fun thing that we have to navigate, but we do all navigate pain as humans as a part of our human experience. And given that we all experience pain, but it's not so comfortable, sometimes it's nice to have someone there to talk to about our pain. And that's where my work as a physical therapist has come in. And I'll speak into my journey. I started practicing PT how many years ago now? Seven plus years ago as a physical therapist, working in the outpatient orthopedic space, and then soon gaining a lot of interest in. Soon I gained a lot of interest in the topic of pain science, and what occurred to me is I started to work with individuals in the orthopedic, musculoskeletal way, and naturally there's pain with injury. I started to notice that something else was happening in individuals who had pain, and that was stress, a lot of stress, holding on to stuff, fear avoidance. And so I quickly noted that pain wasn't just a physical experience, there was this emotional component. And at the same time, I was practicing breath work. I'd gone to Iceland and done a big Wim Hof ice bath breath work experience, and I found that to be so powerful for my own breathing, nervous system regulation. And as I practiced that in my own life, so many aspects of my life improved when I focused on myself, focused on my heart, focused on my breathing. And I wanted to bring that into the physical therapy space. So I started inviting patients that walked through the door with injury before we got started with our exercises to breathe. And on that note, let's all take a deep breath in. Yes, everybody. Yes, you. Deep, bigger. Another sip. Hold it for a moment. Exhale, relax, let it go. Nice. Didn't that feel good? So breathing is powerful. It's autonomic, but it's also something we can use our volitional, voluntary control in doing. So moving forward, what is pain? Pain, by definition, is an unpleasant sensory and or emotional experience. So it's usually associated with tissue damage or potential tissue damage. But the fact that the official definition of pain includes emotion it says a lot about what we know about pain. It's more than just a negative pinch equals ow, that hurt. It's also hurting an ankle, but then having something happen at the same time, emotional pain. There can be so many aspects of pain. And that's why at the very bottom here, I don't only speak about pain. More often than not, when I'm talking about pain, I'm really speaking about pain experience, which is your relationship with pain. How do we experience pain on a moment-to-moment basis, on a situation-to-situation basis? Because pain is personal. It's individualized. We all navigate pain differently. The experience of pain is always changing. We can learn that pain is good. We can learn that pain is bad. Some people enjoy a little bit of pain, but it's biological, psychological, social. It's also emotional and spiritual. There's some components that are deeper than just physical when it comes to pain. And the evolution of pain science has evolved since Rene Descartes said that fire plus finger equals nerves to brain to create pain experience. And then we've evolved to saying, okay, well, it's not just A plus B equals C. If you touch fire, but then a bear comes in the room, your attention will get pulled. You can get shifted away from that A plus B equals C pain experience because there's another factor. So gate theory is something else can interrupt the pain pathway. Biopsychosocial model is a combination of looking at pain not just as physiological, but psychological and social. All these components experience and make up our experience of pain. Neocortex theory is talking about how pain is in the brain, but also it's connected to memories and how we learned pain as a child. We all have a pain learning as a kid. Maybe our parents were very fear and frantic around pain. Maybe our parents said, brush it off, get over it. And we learned to like deal with and cope with the pain. So pain and our pain experience is neuroplastic. It's ever moving, ever flowing, and there's so many contributing factors. Beautiful. And let's breathe. What is breath? Deep breath in, another sip. I like to take a sip, another breath in, do the sip, good, let it go. I like taking sips, maybe 2 or 3 breaths, another sip. Yes, you right now, one more. Hold for a moment, let it go, relax. So breath is the air taken into and expelled from the lungs, inhalation, exhalation, that is breath. But also it's the source of life. In Greek, the term pneuma meant breath, but the term pneuma in Greek also meant spirit. So it was seen in ancient cultures that breath and spirit were one and the same. But yes, we breathe air in and we release it out. That's respiration. Air coming in and out of the lungs, ventilation. You got that reversed. So ventilation is breath, mechanical breath, air in and out of the lungs. So we're welcoming air in and out. It's mechanical. That is ventilation. Apologies. Respiration is the chemical process that happens whenever oxygen makes its way into our lungs, into our body, into our cells, and the oxygen O2 molecule breaks up in a chemical reaction, creating heat, creating energy, creating life. So there's 2 components of breath: ventilation, moving air in and out, and then respiration, utilizing oxygen in a way that creates energy. But it also creates what's called the byproduct of respiration, carbon dioxide. So deep breath in, oxygen, exhale, carbon dioxide. Now we're in kindergarten. This is breathwork basics 101. But if we look at this animation, we breathe in just as I was speaking, create energy, carbon dioxide goes out into the world, creates trees breathe out oxygen for us to breathe in. So it's a circle of life. And we're actively involving ourselves in the world around us whenever we breathe, every single breath. And in fact, we take 20,000 plus breaths per day. So we are constantly engaging with our environment. That's where stress comes in. Our environment holds and contains stress, pressure, life stress, physical stress, emotional, energetic stress. Gravity is a stressor, always pulling us down. But stress isn't always bad. There are positive stressors: starting a new job, growth, learning new skills, exercising, lifting weights is a positive stressor. Negative stress would be usually if you're doing too much, too far, too fast, you're excessively stressing your system, or the opposite, you're not doing enough. So stress is always happening, but it's not always bad. Yes, it can be bad, and likely for most, chronic stress is an example of negative stress that can build up over time in a cellular level that isn't that great, and it creates cellular dysfunction. But how do we empower ourselves? Another breath in, another sip. Hold it strong, good. Exhale, relax. Doesn't that feel nice? So we can interact with the stress of our breath. Deep breath in again, another sip. Hold it, another sip, hold it. Hold it. As you hold, guess what? You are creating a stress container in your body. But as you hold into that and you bring a little strength, what you're doing is welcoming stress resiliency. Okay, let it go. And then catch your breath. So that is stress adaptation. We are made as human organisms, and any living organism is made to navigate stress, adapt to stress, and create growth and resiliency. So back to the biopsychosocial model of pain, we can see pain is at the center of our lives and everything in our lives contributes to pain, and that's our pain experience, because everything that pain is connected to in our life is a part of our life experience. So this is the biopsychosocial model. But there's a convergence, right? It doesn't have to be pain at the center. We have stress at the center of our lives too, because everything in our life is a stressor in some way, and it influences, but how we navigate stress can influence how we show up in the world. So by improving the capacity to take on some stress and hold stress in a positive way, we may potentially improve different aspects of our life. So there's this convergence of breath, stress, pain, stress and pain. And then breath is the tool. For me, this is how I see breath, as the optimal tool, because we can use it at any time. It is free, it's available. All we have to do is remember. Sometimes it's very hard to remember. That's why you hire a breath coach or a PT that knows what he's doing when he's talking about breath, and they can help you remind to breathe. Good. On that note, deep breath in. Again, nice, let it go. So breath is at the convergence of stress and pain. It's a tool that we can put in between pain and stress and create resiliency. So this is supposed to say breath and pain, but the science behind breath and pain is that pain can be regulated through breathing practices. So whenever we take a deep breath in, we are interrupting gate theory, our experience of pain. We can also use calm, meditative breathing to slow our breath, to slow our nervous system. And in doing so, we can modulate our pain experience. So a lot of these studies here talk about breath holding, meditation, relaxing breath. Some of them talk about active breathing. I like contrast breath. Essentially, breath work is the practice of utilizing breath in a skillful way to navigate certain situations in time. So breathing for me is very situation to situation based. So if I have pain, and as an active physical therapist, I'm always getting hurt. And whenever that happens, guess what? I'm like excited. Okay, great. I got hurt and this hurts. And I have an injury and it's uncomfortable, but I don't attach to pain. So I come to pain knowing that it's an experience that moves through, and the body's made to heal. So I trust that healing process. So whenever I have pain, I look at my pain not as a forever experience. I look at pain as temporary, and I use my breath to learn more, not to push out. So I'm not breathing to get rid of the pain. I'm breathing to learn more about the pain, because pain contains valuable information. So a lot of talking, less breathing. Let's take another breath in and relax, let it go. So staying on this topic of the differences between active breathing, reducing stress, there's so many different types. And if you have any questions as I'm rolling, please drop them in the chat. Happy to address those. But we'll breathe, but we'll also talk about the differences, because again, as we've demonstrated, there are ways to increase our breath rate, our respiratory rate. Breathe fast, breathe strong, breathe quick. Let's do 5 breaths very fast, very strong, very quick. Nice. Now slow it down. Slow down your breath. So we can stimulate through breath. And then what else can we do? Through breath, we can, I'm going to stop share and bring myself to the front and center. We can stimulate our body, nervous system through breath, strong and deep. Fast. And then obviously we're going to have to land the ship, slow down our breath, land the ship, breathe slow, breathe calm, and come back into equilibrium. So we welcome stress through breath, and then we regulate back down. And often what I've found with pain, and this is fairly commonplace in the pain science world, is when you focus on pain and you highlight pain, and pain is the star of the show, it's going to take up the full stage. It's going to shine bright and be like, yeah, I am the one and all. But what we want to do really, and this is why I think breath work and stress really support pain as a modality, is let's remove pain from the highlight point. Let's focus on breathing. Let's focus on stress empowerment, stress resiliency, and we can build that capacity through exercises, just like I was saying, stimulation, fast and deep, or through deep movement connected to breath. So I like hands together as a warm up. Something I do with everyone is help them understand that a deep breath isn't your deep, deep, deep breath. That's why I like those sips. Okay, so we'll do one together here, wherever you're sitting. Make sure you're not driving and breathing, right? Hands come together as you inhale, open. So inhale, open, and really I want you to exaggerate your movement. So as you inhale through the lips or nose, let it go, hands come together out. Notice how much movement comes through my spine. Good, deep breath in. Because to take a full breath all the way in, you must move your body. One more in all the way. Hold your breath, turn your hands into fists, show off your muscles, relax, exhale. So notice how the body and breath can work together. Now calm your breath. Roll the shoulders. So we just played with this stimulation and increase of capacity of breath, but now we can play with the opposite. Calm, parasympathetic, relaxation breath. Both are beneficial. I find that I like stimulating breaths because it creates a contrast that's available to help me relax even deeper. So if you're in a stressed state, and most of us are chronically static, stressed out, if you're in this stressed state and you tell your body, hey, breathe slow, but your body's stressed out, your body's not going to be very receptive to calm breath in, relaxed breath out. Your mind's going to be busy. Your energy might be moving all over the place. So it's going to be really hard to calm and find ease in the breath. That's why, again, this is playing off of Wim Hof Method, breath, fast, deep, exhale, hold. We won't do that, but if you're interested, please let me know. The theory is a little bit more Brian McKenzie-esque, meaning gear system, active breathing, faster you go, the more fast you can move energy, and shifting the slow breathing. You can use your breath to control the mind and body. So mindful meditative breath is very good per research. There's a lot of research that supports slow breathing, calm breathing, heart, compassion-based breathing to your body, to your injury, sending positive light. That's good and beneficial. I agree. But I also think that if that's the only way you breathe all the time, nice, calm, slow, and you're never breathing with strength, when does that happen? It happens when you run. So exercise and breath go great together. When you exercise, sometimes you don't think about breath, but you are breathing more rigorously. But once you put the two and two together, guess what? You can amplify your performance, exercise with breath. Same thing goes with stress. You're stressed out and your body's all wired. You can welcome stress into a stressed system, and then that will make your body more receptive to slowing down. And notice we haven't even talked about pain for a couple minutes. But what happens whenever you learn to regulate your nervous system, when you focus your mind on your lungs and your body, you gain a little bit more control. And the game of pain is often that you are out of control. Pain is inevitable. Suffering is optional. It's always happening. So we have a relationship with pain, but if pain controls and dominates the relationship and we have no active participation with what's going on, good luck. You're at the whim of the pain. And so putting pain to the side, improving our connection to our breath control, our capacity to shift our breath levels at different times and setting situations will have a positive impact. When we bring pain back into the body, we're like, hey, pain, guess what? I can breathe with you. I can kind of down regulate the nervous system, the stimulation. Let me go back to this presentation once more. Are we there? Okay, here we are. And again, keep coming with a few questions. I'll save space at the very end to cover these questions. But when we talk about the science behind breath and pain, not cold, but cold exposure is great. If you're curious about that, please let me know. Big advocate, as you may know. But when we talk about the science, there's a Stanford psychologist named Beth Darnell. She's a researcher on pain and pain psychology. And she recently came out, maybe a couple of years ago, came out with a one course online lesson on pain. And she took and created this one session, I think it's 55 minutes online, self-guided, and it talks about pain science. Kind of very similar to what we've talked about in this conversation. Pain science theory is fairly common across the board for anyone who works in the pain science space. So she created this one-time self-guided course and then compared it to other pain modalities and found that the simple act of understanding pain science, knowing a little bit more about pain, naturally helps reduce pain. Because if pain is unknown and scary, it's going to be amplified. Your pain experience is going to be amplified. But if you have a little bit more understanding that, yeah, pain happens to everyone and it's okay, and you can breathe through it, and we're good, and we can work with the pain, and it's temporary, it hangs out, and it's been there for a long time, but I can also focus on other aspects of life and improve these other capacities of body, breath, stress, resilience, and guess what? Oh, now we're coming more in tune with pain control. What happens is pain experience goes down over time. So she's done a lot of research, and she talks about the science and the skills. The skills is, for her, meditation, self-compassion, leaning into understanding pain a little bit more. And that's what I cover in the way that I connect breath and pain, is those three items as well, plus breath. I think what is missing from that she's doing is the active stimulation. If you have back pain from running, I'm not going to tell you just to go run because it might induce more pain. But inducing more pain is not always bad, but I'd rather induce more pain by breath. Deep breath in, faster, deeper, bigger. One more, hold it. Another step, hold it, hold it, hold, let it go. So stimulating your body through breath can welcome and invite heightened pain experience. You're stimulating your body, more stress, more pain. But if you do that after 5 deep breaths, like we just practiced, guess what? Shift, cold, slow breath, long, controlled, self-compassionate breath. And guess what? Now we're controlling the nervous system, but we're also controlling that pain experience, amplifying purposefully just to touch the pain. And then realize, oh, okay, maybe it's not as scary, and backing off. And we want to, again, see how this fluid connection with pain can help improve our overall pain experience. So with that, we breathed a little bit. And if you want to breathe more, I got you. But I wanted to share about how to do this on your own. So building off of that idea that a single session, learning about pain and pain experience can improve pain experience, reduce pain, I created the Breath for Pain 5-part course. If you're interested, I am sharing a promo code for those of you who are here and joining, which will be 50% off. It's a $200 program, and you can share it. And this is my extension of the offer for this Breath for Pain 5 parts. Each video, each module is about 30 minutes long in total. So it's a very short, comprehensive experience with multiple practices and assessments that you can do. But to extend that gift of half off, I would love for you to share with 5 people in your world the same promo code, half off. Let's see if we can get that in the chat. If not, Jordan, if you're here, can you throw that promo code in the chat? So I'll go back. Before we go, thank you. We're not quite there yet, but other ways to learn about pain, and not just pain, but breath, is I have a course called Breath for Stress. So it's similar, but the focus is on improving stress capacity, more so than pain specifically. Breathe Bigger, Breathe Better is about movement and breath. It's a little bit more into that performance-based breathing component. I've created an online community that I will share as well, and also coaching, doing one-on-one breath coaching. If you're curious, how am I breathing? How is this affecting me? I would love to support you. Breath and pain, breath and performance, breath and stress regulation. The power of community to create health is far greater than any physician, clinic, or hospital. Healing starts with you, and my goal in coaching is to help you breathe in and remind yourself of those powerful components. Thank you. I'm going to go into Q&As, and this QR code will just bring you to each of those links. It'll be laid out nicely for you, so you can get your phone out and click and look around. And with that, I'm going to stop my share and answer a few Q&As. Thank you guys for joining and being here. Very, very much appreciate it. Let's see if we have any questions, y'all. I'll wait for a few questions. Thank you guys for checking this out and joining. And if no questions, that just means I covered everything in such an amazing way that we're all clear and good to go. I'll give it another moment, but as we're waiting, maybe breathe deep. Let it go. I'll ask myself one question that everyone usually asks: in nose or in mouth? It's up to you, right? Obviously, if you can't breathe through your nose fully all the way, then it would be wise to take a couple breaths through the mouth every now and then throughout the day to get a full expansion of breath. But nose breathing is superior to mouth breathing for a lot of reasons. It releases what's called nitric oxide, which is a vasodilator, aka when you breathe through your nose, it helps blood flow circulation. And when you have improved blood flow circulation, energy moving through your body, lymph moving through your body, you have better fluidity. Maybe you move inflammation better. So nasal breathing is superior in a few ways. That also it filters the air as it enters the lungs. I find nasal breathing activates the diaphragm a little bit more just naturally. So you get a little bit more of a pulling through the lower diaphragm of the belly, of the low ribs, low lung. So that's maybe a little bit better respiratory engagement with nasal breathing, but it filters the air, cleans the air, releases nitric oxide, and it helps some of the nerve fibers that are connected through nasal breathing are connected to the part of your brain that reminds you to stay calm. So parasympathetic activation through nose. Mouth breathing does have benefits. Sometimes I use mouth. Mouth breathing benefits for me is I can breathe way bigger, let it go. I can take in more breath through the mouth, stronger exhales through the mouth. Thinking about performance, you hear a tennis player, they're using their breath as a form of strength. So I like mouth breathing temporarily as a form of practice, and also in breathwork practices. Another question that just came in is talking about using breath before exercise with patients. Are there any other times before, during, after exercise that you use breath? And so I think this ties in. I also have a course coming out on breath and performance. That's my next one I'm going to do. So I'm covering pain, stress, and performance for athletes. And I believe that everybody's an athlete. We're all athletes. But breathing in that space of exercise before, during, after, it's pretty simple. You are always breathing before, during, and after exercise. So you might as well engage your body with that breath. You might as well utilize your breath in a way that prepares you for the exercise. So breath preparation. And sometimes that can be slow and deep, focused breathing. Sometimes for me, I'm trying to hype myself up. So again, breathing before as preparation can look very different from situation to situation. But I like breath as a prep, breath during, breath to movement, or sometimes Valsalva maneuver can be useful, aka inhale, hold, add a little strength, core, intra-abdominal pressure, strength, stability. So you inhale, hold, press, let it go. Be sure that you're pretty safe as you're doing that, also very familiar. So you can familiarize yourself with Valsalva. A lot of people say holding your breath while exercising is really bad. It's bad if you don't know what you're doing and you're not practiced in doing so. I use breath holds as a stabilizer of my core frequently, but I'm doing it consciously. I'm not unconscious holding your breath and then tightening, and that's how people faint, pass out. So know what you're doing, be practiced in what you're doing, and then rest and recovery in between sets or after sets, regulations, slowing down, going from gear 5 fast, slowing it down to gear 3, gear 1, nice, slow, calm. So I believe through practice, experience, and research that you can increase your recovery through active breathing. It's phenomenal as a tool. And this is for performance. But then I'm thinking about whenever I'm working with someone with pain and doing injury rehab, and we're going through something that kind of hurts, guess what? You prep for that movement that might hurt, but we're going to not go too deep into the pain, but we might experience that pain a little bit. Prep, hold, maybe move breath as you're moving with that injury to help get circulation. Then after your shoulder might be sore, so calm breath, deep breath. Relax the shoulder so it can fully open, move energy, and recover. How's that for an answer? I love it. With that, we'll conclude. But if you're watching this and you don't have the link, Empower, EMPOWER, that is the link for 50% off of the Breath for Pain course. I'll pull up that QR code one more time. So the QR code here will take you to courses, content, coaching, everything we're doing at True Self Health. And if you use the code EMPOWER, you can get 50% off the Breath for Pain course. Would love for you to share. Again, the offer extends out into your community. Share it with a few people who may be suffering from pain and not know what to do, and you might want to help empower them in that process. So on that note, I really appreciate your time on this webinar. And as is shared in the chat, there's a lot of ways to connect and work with me. Thank you guys for joining. One final breath, deep breath in all the way, deep, deep, deep. Hold it, another sip, another sip, another sip, hold it. Hold for 3, 2, 1, let it go, relax. Good job. Thank you for joining.